Weight loss pills versus obesity drug race. Hi friends, I'm Elizabeth, Countess of Shopping. I am your GLP-1 medication enthusiast, having been on Mounjaro and Zepbound the last 18 months, having lost over 90 pounds and going from morbidly obese now to simply just overweight and on the race to my 100-pound weight loss journey. But on today's episode, I want to dive in. There is an article in Forbes which links to a couple of other things that I will link and cite my sources down in the description link below about weight loss pills intensifying in the obesity drug race. Here's why experts say that injectables aren't going anywhere. And I know so many people who are on either Semaglutide, Tirzepatide, Wegovy, Mounjaro, Zepbound, all of the GLP-1 medications. Why having a pill format versus an injectable is super advantageous. And so the competition is heating up. There's a new Roche, R-O-C-H-E, coming out of information about pill format. Pfizer's coming in there, and it's heating up with these different medications. So let's go down to this study. It's very interesting to me about the director of West Virginia University's Medical Weight Management Program, Laura Davidson, told Forbes that weight loss pills may not be for everyone, explaining the adherence for pills tend to fall on the frequency of dose, especially if it needs to be taken more than once a day, and that dietary limitations or restrictions, such as having to take it on an empty stomach, lessens the drug appeal. Though it may be challenging to find a formulation that works as well as an injectable, it can be done with Novo Nordisk. And Novo Nordisk they are the maker of Ozempic and Wegovy. They already are making and they're already marketing. I looked this up so I can pronounce it. I practiced before I got on here. Now I'm having like stage fright if I can't pronounce it properly. Rybelsus. It's the Rybelsus. It's the pill form of semaglutide, the drug inside of Wegovy and Ozempic for diabetes. And firms like Eli Lilly and Pfizer are making progress on a small molecule GLP-1 agonist from orforglipron, which I did a whole story on, by the way. That's in my playlist if you want to go look it up here on Countess of Shopping. And danuglipron, that delivered orally and appeared to rival weight loss achieved by injections already on the market. So it's interesting to see where this is going, because I know we are in GLP 1.0. And I've been talking, my husband and I have been having this increased dialogue about GLP 2.0 of where is this going? I mean, I've been on a GLP-1 for the last year and a half. My life has totally changed. And so hearing these clinical trials suggest oral drugs compare favorably to injected weight loss medicines and can potentially offer a similar degree of weight loss with similar set of side effects. It's possible companies developing them could opt for lower degrees of weight loss to mitigate side effects, or more than once a day dosing schedules required to overcome the difficulties from getting the drug into the bloodstream. Even if a pill is less effective at producing weight loss than available injectables, it will still find a market. We need all the tools we can, says Davidson. A medicine that has the unique characteristics of being given orally would actually be useful, even if it is less effective than the injectable GLP-1 medication. For example, injector pens can drive up manufacturing costs and often need to be refrigerated, which can limit access. And so we've been talking quite a bit in my free encouragement group about costs for GLP-1 medications. This is interesting. It's another outlet of how, when I say don't worry, like don't worry in terms of cost and these other things, so much is in the back end of the pipeline that we're seeing this tsunami, so to speak, of what's to come. So for example, it talks in here, while patients don't mind injector pens, Stanford endocrinologist Sun Kim told Forbes, injections can be very daunting for other patients, which I have personally seen firsthand too. And these patients can benefit from having an oral option. So much so, like giving choices here, so much so. So Ozempic and Wegovy maker Novo Nordisk is ahead of the pack when it comes to getting out the oral weight loss drug to the market. The Danish giant is the maker of the only authorized GLP-1 medication. Rebellus. I'm so sorry. I practiced this 10 million times before I got on camera, and there's going to be a negative Nancy out there. Sorry, Nancy. There's going to be It's gonna like rip me a new one because I'm mispronouncing it. I apologize. I tried so hard before I came on. Ribelsus. It's Rybelsus. It has a sizable first mover advantage when it comes to securing approval for another condition. Novo Nordisk cannot launch the drug as a weight loss pill without risking its leading position with its diabetes and weight loss bestseller Ozempic and Wegovy. Ribelsus is simply an oral formulation of the same drug, semaglutide, and the company is already failing to produce enough to meet the demand. Compounding the issue is its dosing. With the oral version requiring much more of the active ingredient than the injectable counterpart, Novo Nordisk has already delayed asking regulators to approve the drug for weight loss and is conducting clinical trials to test a lower dose version using less semaglutide. Eli Lilly and Pfizer are both working on promising once daily pills or for Gilapron. I'm mispronouncing that, my apologies. I practiced saying that too before today's videos, and Danuglipron, Danuglipron. Roche has touted promising results from 2 candidates in early stage trials. So weight loss pills, it says, Kim says, I do worry about the environmental waste associated with injectable therapies. Many GLP-1 medications use 1 pen for 1 dose of the injection once weekly. That's 52 pens wasted and dumped into the environment. Hopefully new formulations will be mindful of how to reduce waste. So when we're talking about waste, with these pens, I agree. With the oral pills potentially coming in the pipeline, it's going to be cheaper for patients, and I think it would make less money for the companies making it. Says Shauna Levy, an obesity medicine specialist at Tulane University of Medicine. She added that companies have proven they can make effective oral version of the GLP-1 medications. I think this is one of the main reasons they are not currently pushing for oral semaglutide and saving all the semaglutide of injectable medication. Fascinating, friends. I find this fascinating. I don't know about you guys, but I nerd out over this stuff. I find it so fascinating. I wanted to go over to talk about the pill with Roche. I had pulled that up to talk to you guys too about weight loss pills. The Count keeps sending me all these. The Count is on it for you guys. The Count, you will never see him online, but he is behind the scenes so invested. Like I tell him all of y'all's stories, and he's so invested. So when we were talking about the pill format for these, it was on Roche. I wanted to read more about that. Fiddlesticks. This was I had this other article pulled up, and now it's not. No, it's not pulling up. And I wanted to show it to you guys so badly. You know what is pulling up? My Golden Girls. My Golden Girls episode on here. I wanted to pull up this other one. Basically, it's talking about how Roche, it's another company, about how they're working on the oral pill and how it's getting through stages of working through that of effectiveness. So that's exciting. And I think that that's cool. And one of the things I wanted to talk about on today's video is, and I'm curious with my unofficial Countess of Shopping poll down in the comments, which would you rather have, a pill or an injectable? And that's what I thought was interesting, of where you would take it on an empty stomach, taking the pill, but it's less effective than the injection, or just stay on the injection. For me, I'm at the highest dose. I'm at Zepbound 15 milligrams. I need the higher doses to come out. So the pill format would not be so good for me, because it sounds like it's less semaglutide in it so far. And I need more than the Zepbound 15, because I'm at that capacity now and have been for quite some time and have been stalling out, so to speak. But I do think it's interesting, the pill format, for people in my free encouragement group who talk a lot. And recently there's been a lot of talk about side effect issues, which the most common ones are gastrointestinal, diarrhea, nausea, constipation. And so if you're taking less, that's going to help lessen those side effects. Because one of our poor group members, bless her heart, she's been vomiting profusely. Now, is that more of an exception to the rule? Kind of. I mean, people do have discomfort, but it's not where it's really like this person had to go to the emergency room because they were vomiting so much. And I do think that's definitely an outlier. I'm not a medical healthcare provider. I always punch you back to your healthcare provider to talk about these medical questions and things like that. But I found this fascinating about, there is a race on right now. the Olympics are getting ready to start soon on TV as I'm filming this. And so I think that the Olympics are heating up in general, but they're heating up in the GLP-1 weight loss community for type 2 diabetes, for chronic obesity management, and other FDA approvals too for GLP-1 medications that we're just getting started. Like, this is the 1.0 version. I'm stoked for 2.0. And I'm stoked for what is in the pipeline and how many people are entering this race because of the massive success that it's had. And so I find this fascinating. I really wanted to share more about the Roche, ROCH, pill format, but that's the bottom line. And I thought that Forbes magazine, it's been interesting to me. Sidebar, Forbes, I'm a businesswoman by trade. I'm not a healthcare provider, as I mentioned. So me talking about GLP-1s is not, talking about business is my natural inclination. I'm a good businesswoman, a very good businesswoman, which is why I love reading Forbes magazine. It's interesting to me that Forbes magazine is devoting a lot more attention to GLP-1 medication. Like, I find that fascinating. And I know that they're doing it from the standpoint partially for stocks and things like that, but I have, sidebar, have taken note of that, of where GLP-1 medications are popping up. The fact that Nestle's food company is having a whole division now for because of GLP-1 medications. Like, we're changing things, friends. From morbidly obese to having all of these changes. It's been pretty cool. So, sweet friends, what your accountability question today: what are you doing today to move you closer to your goals? Number 2, I want your emoji of the day is going to be a sunshine, because you're a little ball of sunshine, said Blanche Devereaux. So put that down below. That's like our bat signal that you've made it this far in the video, and I truly want to get to know you better because I care. I will also pray over you. If you don't believe in prayer, I'll uplift you in positive thought, because this is a positive community. And if you want to join my free encouragement group, it's linked down in the description link below, as is my sources for this whole video. The sources, and also like all my free stuff, my free meal plan, the free group, my free email list, countessofshopping.com, my free blog, a ton of free articles over on that site as well. So great coverage going on this week. Great news week for GLP-1 medications, and lots to come. Really exciting. Speaking of things that are to come, Eli Lilly is going to have their second quarter investors meeting soon. It's coming up here in August, near the beginning of August. I will be covering that like I covered the Q1 Eli Lilly investors meeting. I will be doing, no, it's not the, yeah, I was gonna say, is it Q2? Yeah, it's Q2. Is it Q2? It's their next investors meeting. I'm going to be talking about that because usually on those, they also release nuggets of GLP-1 medications. So I'll be talking more about those. I'll be talking more about that. Will be, because they always have really cool, interesting stuff on there. And if you're I'm not a stockholder, but if you are a stockholder, that will be interesting. So, sweet friends, I felt like there was something else I had to share with you guys, and now I'm forgetting. I came in, we were playing outside, and I keep getting these news alerts on my phone, and so I got a couple, and I was like, I'm just gonna go up and film. Even though I look kind of ratty, I was playing outside. What a gift of the GLP-1 medication for me to go play outside with my kid. Sidebar, if you've not gotten my magnesium breakthrough, it's not mine, it's the one that I recommend by Bioptimizers. They have given us a 10% off discount code QUEEN, QUEEN. Amazing for constipation, amazing for sleep, amazing for muscle recovery. Magnesium, I just did an interview with a leading expert on magnesium and why it's so important, and particularly for me, why it's been so important for GLP-1 weight loss. Highly recommend. That is linked down in the description link below, as is, I've switched over to, and I'm loving, Bioptimizer's Protein Breakthrough. It's delicious. It's plant-based too. And that also has an extra 10% off not gift card, 10% off code for Queen, QUEEN. It has 23 grams of protein in there. The Duke is obsessed. We made, I think I showed you guys, I showed you on another one of our, we made a protein popsicles out of them with Greek yogurt, the Bioptimizer's Protein Breakthrough, and a little bit of nuts. It's so good. Tonight I'm gonna make, it's called Protein Mud. You mix a little bit of water, a little bit of the protein powder, and they have it's a gut supplement that they also have that I've been testing it. I haven't released it. I only release things that I test and try, and then I give like my Countess of shopping. So I'm still testing it, but it's called Protein Mud. Mix that together. So I'm going to be having that for dessert later tonight. I'm very excited. Very excited. Very excited to see if I like it. But the Duke was obsessed with these popsicles. It's funny what, I don't know. He was very excited. I was like, okay. I thought they were good. He thought they were excellent. I'm going to tweak that recipe a little bit more. It's really good. I think it actually needed less protein powder in it. I put too much in, was part of why I didn't like it as much. He liked it because it was very flavorful. I would have had probably just a little bit less protein powder in there. It was really good. So sweet bread, and we have protein to help. I have protein to help combat muscle mass loss and also appetite suppression. It's like the 1-2 punch of having that. Sweet friends, be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. Make sure you share this video if you have somebody who's interested in GLP-1 medications. They're not wanting to take them because of the injections. The information that's coming out on pill formats, fascinating. Okay, I look forward to seeing you guys again tomorrow. Bye, friends. Love you.